I'm going to introduce to you Paul Magginetti. As a dedicated citizen advocate, Paul Magginetti brings extensive experience from his career in the life sciences industry to the forefront with his efforts to educate planners and citizens in his community. With over 40 years of experience in manufacturing, R&D, scale up and transfer, as well as serving as a quality assurance engineer, he has deep understanding of the field. Throughout his career, and which since basically the start of the AIDS epidemic, he has observed the evolution of biosafety practices, and he is now turning his attention to his local neighborhood, which is undergoing a transformation as new life science labs continue replacing the brownfields left behind by the semiconductor industry. Paul's talk comes from a very knowledgeable but very local resident's perspective. Paul?
Thank you, Steve. So my name is Paul Magginetti. I've worked for over 40 years in the life sciences industry, developing tests for infectious diseases and other disease states. I want to use that expertise to present an informed resident's point of view. So you've seen from the previous presenters how risks are addressed. So I'm a little jealous of the system that they have on the East Coast because it turns out that we don't have that. It's not the case in San Mateo County, especially for the private labs for BSL-3, that we have the level of control that they have. Not all BSL-3 labs are sufficiently regulated. As mentioned, the private ones are not required to certify their labs. There's no requirement for these private labs to report the nature of their research or the proposed precautions. Cal OSHA does not address risk to the community, only to workers. There's no reporting mechanism to monitor biohazard incidents, such as finger sticks. There's no mechanism, except right now for COVID-19, for community monitoring of a biohazard release. Outbreaks can only be detected after they happen. There's no plan for a response to a biohazard release, and there's no requirement for a plan to safely decommission BSL-3 labs, a lesson we learned the hard way with all the brownfields that have been left over from the semiconductor industry. So the consequences of a lab accident, so we've covered that already, the previous ones. Biohazard agent level 1 usually doesn't spread beyond the lab worker, nor does a biohazard level 2 agent. A biohazard level 3 agent, especially if they're airborne, can spread beyond the lab worker into the community and the environment. These are very serious airborne diseases, and once they spread, they can be very difficult to control. We're living through that right now with COVID-19. Another such event could just be a finger stick or a poorly fitted mask away. So industries in general, they don't have a good track record when it comes to evaluating risk, and they're not good at leading when it comes to mitigating risk. Warnings from experts within industries often go unheeded. Industries frequently resist regulation until after the negative impacts are realized. When the impacts are realized, the cost is frequently passed on to the community. And here are some examples. Snow for Wizard of Oz was actually asbestos. In the 50s, we were told that we could get rid of our batteries by just throwing them in the fireplace and burn them up. In the 60s, we were told to get rid of our oil by pouring it into the backyard. DuPont told us that Teflon was perfectly safe long after we knew otherwise. And Monsanto's, despite facts to the opposite, told us PCBs are perfectly safe. They were a miracle chemical. Fukushima. So in Fukushima, they ignored a 1 in a million chance event. They rolled the dice, and unfortunately, they paid the price for it. And just recently, the railroad industry recently successfully lobbied to roll back safety regulations. And this is one result. So from the outreach that we've done, we found that developers in the life sciences industry here in the Bay Area, they're going to tell you that biosafety labs are very safe and they have everything under control. They will tell you that they've never had a problem. There's been there's no more need for oversight. In my opinion, this is an example of hubris. This is not always true. Lab accidents can and do happen. So these are just a sampling of recent examples of lab accidents, some of them very serious. COVID-19, we may never learn the truth, but the fact remains that a pandemic caused by a lab accident is a real possibility. Experts in the field are even now advising federal agencies that tighter controls are needed for BSL-3 and BSL-4 labs. So before you consider a biosafety lab in your area, you need to have the answers for the public to some very important questions, especially for higher risk labs, especially for BSL-3 labs. So first question is, how will you determine the location of a biosafety lab? I'm going to state the obvious, well, I'm going to say what should go without saying, but a BSL-4 lab should not be allowed in any urban area. That just makes no sense at all. Should not site them near sensitive land uses. Don't put them near housing, schools, senior care, child daycare. Don't site them in locations with a high risk of failure, locations that are prone to flooding, liquefaction from earthquake, wildfire. How will the proper design and operation of a biosafety lab be verified? We need something like was just presented earlier for a local ordinance for all biosafety labs. That all biosafety labs be OSHA inspected, that all biohazardous waste be disposed of by a monitored procedure. These are both by state law. All BSL-3 labs, including the private ones, they must be certified and annually re-inspected to the NIH standard, either by the NIH or an accredited third-party certifier, as was mentioned earlier. There are some that do just that. They need to be retained by the city, paid for by the applicant. How are you going to document these procedures, and how are you going to make sure that people are going to follow them? You need to have a written safety plan. You need to have documented training records to that safety plan. You need to have notification to the community stakeholders, to city government, to the health department, fire department, community oversight committees. I hope someday we have one. How is you going to prevent a biohazard release? Safety plan must include employee health monitoring, incident reporting, corrective actions when indicated, up to and including revoking a permit. If they're too sloppy, they probably shouldn't be operating anymore. Periodic reviews by local health department subject matter experts. Does your health department have that expertise? We've looked around and we found that there's plenty of people with expertise in chemical hazards, but when it comes to biological hazards, that expertise doesn't seem to be there. How are you going to detect a biohazard release? Is your only method of detection when people start getting sick? That's not a very good detection method. Your health department is going to need to know what to look for. They're going to need to know what agents are being used, how their monitoring system needs to be designed to detect it. They may need oversight by the CDC. What is the disaster response going to be if there is a release? Is there going to be a county emergency response plan that includes community notification, alerting the first responders? You may need to notify the CDC or the Homeland Security if there's a release. How will the proper decommissioning of biosafety labs be assured in the future? We have We have properties from the semiconductor industry that have been abandoned in their brownfields and nobody wants to clean them up. Don't leave this to chance. Businesses can fail, leaving behind biological brownfields. What if Theranos had a BSL-3 lab? Who would be responsible? You may want to consider requiring a bond for decommissioning so that 10, 20, 50 years down the line, these labs get decommissioned properly. This should not be the responsibility. This should be the responsibility of the landowner and not the public. So for those elected government officials and government staff, you are responsible for the health and safety of the community. You need to make developers and commercial interests responsible for their own risks. No community benefit is worth a safety risk. Any community benefit or risk trade-off is fraught with moral hazard and erodes public trust. Have a plan in place for when the unthinkable happens. You need to create clear rules that require all BSL-3 labs, not just the ones receiving government money, follow the NIH guidelines. These rules must be transparent, include independent review, community input, and be subject to public hearings. Until oversight rules are in place, I really recommend that you should not be permitting new BSL-3 labs, especially for those private labs. There doesn't seem to be anything in place for any oversight of those labs. In closing, I would say there needs to be an independent audit by a subject matter expert to objective criteria. That is how science works. We aren't credulous people who get our information watching The Last of Us on HBO. We are engineers, we are scientists, we are chemists, architects, IT professionals. We can't be convinced by smiles and hand waving, patronizing and gaslighting. We have real concerns. We expect them to be taken seriously. A biohazard leak due to a lab accident is one lottery we don't want to win. Thank you for your attention.
Wow. Thanks, Paul. That's a lot of great and very direct information, as well as a history lesson. I had a joke prepared to talk about Wizard of Oz and that stuff, but I don't think that's appropriate now following your talk. So
it's not funny. It's really serious, and we need our government officials to take us seriously.
Very much so.